Are oral appliances right for every snoring patient? Not always. Oral appliances are most effective for patients with mild to moderate snoring who also have good dental health. They're especially helpful when snoring is position dependent or linked to jaw positioning. That's why training matters. A proper evaluation helps dentists determine who's a good candidate and when other therapies may be needed. At OHL Practice Consulting, we equip dental teams with the knowledge and systems to confidently evaluate and treat snoring patients. Call 713-489-9937 or visit ohlpracticeconsulting.com today.